And in army-ruled Myanmar, some nurses are hiding from the military junta to run makeshift clinics and treat COVID patients. Take a look at this report with more details.
A handful of nurses in Myanmar are on a secret mission. While hiding from the country's junta, they are treating COVID-19 patients and resistance fighters. The medicine is smuggled past military checkpoints.
It's like we're risking our lives when we transport medicines. The military search everyone at their checkpoints and arrest people they find carrying medicines.
Healthcare workers in Myanmar are at the forefront of a civil disobedience movement against the coup. Crackdown on dissent following the military takeover has killed more than 1,300 civilians. One of these nurses left her job in a public hospital soon after the coup. She began volunteering in Kaya state in Myanmar's east. Military and anti-coup fighters have clashed repeatedly in the region. A boycott of government institutions has left many hospitals without staff. The military junta has arrested and killed scores of protesting health workers. Even these nurses know that they have to be ready to flee and have their bags packed for that eventuality.
At first, I was volunteering with Civil Disobedience Movement Group in Lauka. When the fighting started here, I was told there weren't many doctors and medical workers in this area and that villagers were asking for them. But it was impossible to find doctors at that time. So I made the decision to come and try to get hold of some medical supplies.
In Kaya, around 85,000 people have been displaced by the violence. Many of them are crowded into camps where infections spread easily. Most of the patients are displaced families. Patients also include fighters from militias that have sprung up across the country to fight the junta.
Most of our patients are PDF fighters and displaced family who can't go back home.
After a devastating COVID wave in June and July, the junta has said that new infections are down to 150 per day. The Omicron variant is yet to appear in Myanmar. But with the struggling health system in shambles, limited testing is being done. In one village, the team conducts swab tests through a small tear in the sheet of plastic stretched over a bamboo frame. Those who test positive are prescribed paracetamol or vitamins. That's the only medicine on offer. Donated oxygen must be used sparingly. Refilling canisters involves a trip to the closest large town, where they have to pass through a military checkpoint.
We can only use a very limited amount of oxygen and we have to go Lyoka to refill the canisters. We also have to disinfect our protective equipment and use them again because we don't have enough.
In areas with strong resistance to military rule, the junta has blocked the delivery of humanitarian and medical supplies. People found carrying medicines are arrested. In the 6 months following the coup, 190 health workers have been arrested and 25 killed. But these nurses are determined to save lives, even if it involves risking their own. Bureau Report, WION World is One.
WION is now available in your country. Download the app now. Get all the news on the move.